need for awareness and immunization against Respiratory Syncytial Virus, RSV. In India Bengaluru, India, July 8, 2025, medical experts in India are calling for urgent attention to Respiratory Syncytial Virus, RSV, a highly contagious but under-discussed cause of ower respiratory tract infections in infants and children under 5. RSV, often mistaken for a mild seasonal cold, counts for tilde 3.6 million hospitalizations and tilde 100,000 deaths in children under 5 each year globally. India, with the largest birth cohort OF tilde 2, 5 million newborns annually, contributes significantly to this burden. The impact is particularly severe during the country's monsoon and early winter months, when neonatal ICUs experience a surge in admissions. Alarmingly, even healthy, full-term infants across all socio-economic base grounds often require oxygen or ventilator support due to RSV-related complications.
Countries like where we are sitting right now, there is a very ill-defined season with a couple of peaks. One of the peaks is in monsoon, in rainy season. The other peak is in winter. Now monsoon also, some of the parts of the country have two monsoon seasons, and predominantly the peaks are during these seasons, but then the only months that tend to escape are March, April, probably sometimes May, and at times November if it's a hot November. But otherwise all of these months are equally sort of RSV is equally circulating in the environment, and in most cases it causes cold-like symptoms. But what I would like to draw the attention is at the bottom corner of the slide in the dark blue circle, that this can progress to severe lower respiratory tract infections like bronchiolitis and pneumonia in infants. Now there is a spectrum of severity, as I said, from upper respiratory tract to lower respiratory tract, and the LRTI or lower respiratory tract infection manifesting as either bronchiolitis, which is infection of the bronchioles, or pneumonia, which is eventually infection settling into the alveoli.
This is the pediatric age is very vulnerable age, and this respiratory syncytial virus doesn't stop. बच्चा बड़ा हो जाए, ये हो जाए. It starts from at the beginning. So it can be at the day 1, it can be there, or it can be up to 2 years. Possibility of the infection up to 2 years is more as compared to because they develop their own immunity afterward. And it's not like other viruses that or other diseases that you get the immunity. Like a COVID, what happened? Automatically you got the immunity. Though we have given the vaccine also, it's not like that. It's a very short immunity after the disease, so that we want to prevent. Now, see, this is up to 2 years. They are very much prone for complications, and main disease is there. They are developing pneumonia. Whenever we study the pneumonia, cause of pneumonia, the most of the cases, 70%, 80%, 75% cases are from viruses. And the viruses, there are so many viruses. You might have seen influenza virus, adenovirus. Most of you have heard about the influenza virus because there was a large epidemic. But looking at the study and everything, we have seen that the RSV virus is the most commonest virus which affect the children population. So automatically it gave us the importance. You might have seen the scenario of 1 year before in Kolkata, that 6 months before that in Bombay, and same in Bangalore. So many cases of RSV infection we are getting, not that to be simple.
Hi, I'm Dr. Bhavesh Kotak. I head medical affairs for Dr. Reddy's in India. We are here today because along with Sanofi, in a strategic partnership, we are here to launch the product called Nirsevimab or Beyfortus in India. It affords passive immunization and protection against the disease caused by respiratory syncytial virus in infants. Now, infants are the target of the RSV because their immunity is at the lowest. Kids are born with innate immunity, but their adaptive immunity is not at the best, and it's the most vulnerable stage of their life. Most infants are exposed to RSV and get an infection. Say 50% of them are exposed and get an infection in the first year of their life, predominantly in the first 6 months when the immunity is at the lowest, and close to 90% plus, nearly 100% are exposed to this virus in the first 2 years of their life. Of all the acute respiratory illnesses, if you did a survey, 66% of them are caused by RSV, the virus which is predominant in all communities. India does not have seasonality for RSV. It occurs throughout the year with two peaks, one in monsoon, one in winter, with a couple of months being sort of at lower incidence than the others, maybe April and March. The kids need to be protected because their immunity is at the lowest, and while it causes a milder disease in most of the infants, without a biological marker and without an ability to predict, some of the kids develop a very severe infection in the form of bronchiolitis and pneumonia. That puts them in an ICU because their lungs are not mature. They could eventually require ventilation and they would be in respiratory distress. There is no treatment for this virus and only supportive care is afforded. A small proportion of those kids also unfortunately pass away and are victims to this disease. It's a statistic that we are not proud of in India. Of the 33 million cases worldwide, 97% are in low middle income countries, and out of those, 12.9 million LRTs get admitted, 100,000 deaths occurred globally. Again, 97% of the deaths are in low middle income countries. Now, these are totally preventable. Now we have means and measures of combating this disease. If we can't treat it, we can at least prevent it. Nirsevimab, Beyfortus, affords the protection fully from the time you give the first shot. So ideally, a kid, an infant who's born, a precious child who's born, should get this vaccine before discharge in their very first few days of life. It will prevent the occurrence of this disease, them contracting this disease, and the horrible complications that occur. And again, as I said, it's very difficult to predict which child will get the severe disease. Hence, it is important to protect all children.
Yeah, I am Dr. Vasant Khalatkar, National President, Indian Academy of Pediatrics, an organization of 49,000 members of pediatricians. So, talking about RSV, basically this is a very bad virus which affect only respiratory system, that to be very bad in children, and that to be up to age of 2 years. It can affect at the 1 day, it can affect 2 days, it can affect the elderly also, but the complications like a pneumonia, bronchiolitis and all lung related diseases are more common up to age of 2 years, because children up to 2 years don't have a best immune system to develop. They are very much prone for infection, and sometimes that can go to common lung disease, then it can ILD like this, and this can lead to exacerbation of asthma also. So this is a very critical. Last time we have seen cases in Kolkata, Bombay, Bangalore, Hyderabad. Those are metro cities that where it's notified. We don't know what is the status of a rural area, but definitely this is a droplet infection by spitting or through one-to-one contact. It can go. So this is the way of infection. And what is the complication? Child can go to pneumonia, child can get hospitalized and need a ventilation because of a respiratory stress, because lung volume become less, and child is having very lung volume as compared to adult. That's why suppose you take the SpO2, you know that pulse oximeter, that if saturation less than 92 in children as compared to 85 in adult, we have to take the help of oxygen. So because of their low lung volume, and that's why such a disease where death can also occur, we can lose the child. It's a better way to prevent. So definitely it is going to help a socio-economic status, our mental status, emotional and disease burden definitely. Because once hospitalized, you know how the expensive it's a child has to admit in ICU. That's why this is, so this is the vaccine nowadays available. It's a vaccine which can give the immunity up to 6 months to 1 year. So first dose to be given at the day one or before discharge from hospital. Whenever mother gets discharged from maternity hospital, before that you have to give, either if suppose miss, then whenever that mother come for first visit, at least that time, or up to 1 year. There are two type of doses are there, up to less than 5 kg and more than 5 kg. There are two type doses that we can, it's a better, without consulting doctor you should not go for that, and that's a definitely way, because you all know we are after prevention is better than cure. So that's our basic aim. So my request is that you all parents go through literature and take the vaccine.